All right, good afternoon, everyone. Welcome to June office hours. Can everybody hear me okay?
Yeah, I can hear you. Can you hear me?
All right, great, thank you.
Yes.
And we can see the PowerPoint in the chat box. That's all showing for folks as well.
Looks good.
Perfect. Well, again, welcome everybody. Happy summer. And we'll get into today's agenda. I wanted to just let folks know we're recording as usual. I know I mention this every month, but just wanted to make sure folks know this will be available on our training webpage in the near future. And we'll make sure that folks can have that. So let's get going. And then if there's questions along the way, feel free to use the chat function or um, just chime in. So we'll do policy and procedure as usual, our children's updates, quality management and performance updates. Want to touch on the CFR reporting again, and then just status on the recalibration proposal to DOH for budget related information. So we'll kick off with policy and procedures. Yes.
Hello. We didn't have any new policy and procedures that have come out for this month, but next month we will be going over our updated interpreter services policy and then the annual update to assignment and referrals. But did anyone have any questions on any current policies that they wanted to talk about today? Okay. Well, if you do, you can always email the health home if you have any questions. Children's updates. Our HCBS audit began yesterday and it is scheduled to run until Friday. However, I just wanted to point out that the auditors typically will need access beyond that Friday date. They tend to run a little bit behind. So with that, and also with the July 4th weekend coming up, so obviously they'll have off July 4th, but I just want to make sure that there's someone at each CMA that I can reach out to in case they need something from me. If they request documentation or they have a question on a record, we only have a 24-hour turnaround time to get back to them. So with the holiday, that really only leaves potentially Friday and then the 3rd. I think that we'll have an issue with. So if you want to email me directly and let me know an alternative contact, that would be great. Typically, I will contact multiple people at each CMA. The other thing I wanted to point out is that we also received an annual wellness Excel sheet. Each of our members who are being audited currently, we received an Excel sheet on that has notes of their annual well visit. We only received information and data on these particular members. I will be sending that out. That indicates if they've had one completed, if they're overdue, and the date that they are due or were due. But this gives us an opportunity just to send out a reminder that is extremely important that we know the dates of our child well visits for all of our youth enrolled in health home, and that is anybody 21 or under. We are scored on anyone under 21. And we need to, this is a state compliance measure that we're scored on. So it's important that everybody know these dates and make sure that they are tracking them so they know when the annual visit is due. Does anyone
I
have any questions on that?
I just had a comment about how ideal it is to have an audit going into a holiday weekend. It's nice.
It's
So
perfect
we
timing. It
share.
happened last year
Yeah.
as well. They love it.
So we share the enthusiasm that you all do around that this will be affecting. So it's good times.
Okay, we can go to the next slide. So more updates on the IRAM system. Just a reminder that the electronic HCBS referral has been pushed till August. That is still the date that they're looking to go live with that electronic referral form. The reason for that pushback was because they are doing the training tracker now in IRAM. So last year, everyone sent me that Excel sheet that had every care manager on it for children's care management and the date that they attended those required trainings. That Excel file will now be electronic in the IRAM system. There is a webinar tomorrow on this. You need to register. Everyone should have gotten the registration information on how to do that. And then a reminder, we talked about it last month, but each CMA will need an HR representative or a personnel person to have access to IRAMs in order to input those trainings for the health home care managers. It could be 2 to 3 people per CMA. And they have confirmed that the previous year's Excel file that you have sent me, they're going to import into IRAMs. So you will have until July 31st to go in and verify that those staff members that are listed are accurate. So if people who have left your CMA, you'll have to remove them. And if you've hired new staff, you'll have to add the new staff with the new dates. And this is anybody that has left or arrived since a year ago, and that was on that training tracker. If you need a copy of that training tracker to go in and verify, I did keep a copy of everyone's Excel file that they have sent me. Does anyone have any questions on the IRAM's training tracker? Okay, well, we'll have more information tomorrow. I have not seen it either. But after tomorrow, if you have any questions, please reach out. And if you want a copy of that Excel file that I have, I can send that to you.
All right, thanks, Jess. I want to touch on redesignation process update for Health Home. So, Department of Health brought forward over the past month that they are looking at the redesignation audit tool for lead health homes that would go into effect moving forward as of August of this year. So, as they're looking at that tool, they're changing the scoring categories for designation for health homes, and the scoring criteria is tougher than it used to be. It's still the tool's still not finalized. We're supposed to in the next week to 2 weeks get the final audit tool copy for the August implementation, and they'll start using that as they start to audit health home leads for redesignation moving forward as of August of this year. I'll just say before I go further that our redesignation as a lead health home is not due until next early spring, late winter. So March would be our next time. So it gives us a block of time to see the new tool, to look at it, to go through it thoroughly, etc. But with that being said, the scoring criteria is changing. So they're talking about, as you can see here in the middle for consideration, doing a de-designation category. So that would be any score below 70 that would be either on, the program that's being scored. So for adults or children at this point, the de-designation score below 70 is a new thing. That's something that wasn't in the policy in the past. It's a new policy to be put forward, which is a big deal because that was never there in the past. DOH's stance on this is that other states have done this, other programs have done this outside of health home. So they're feeling that it's important to incorporate a de-designation policy. So that's going to cause us as a lead to have to put that into policy as well through our quality assurance and improvement policy. So that'll be forthcoming once we see what that entails. The 6-month designation score is changed 70 to 90. This again is being proposed at the moment. We don't have the final until the final audit tool comes out. But what's being proposed by DOH, the 1 year would be any score that ranges 80 to 84. 2 year would be 85 to 89. And then as you see, 3 year, 90, 95. And then there's a 4-year designation category now that is being considered that it's not in existence currently. So if this does go into play, any organization that would score 95% or above would be a 4-year designation status. And that's all scoring on the domains 1, 2, and 3, as you see up a little bit higher on this slide. Domain 1, which is policy review, any training around those policies for networks. How do you manage that to ensure that your provider network's aware and knows policy and implements policy? So that's a big thing that's assessed for leads. The measures in domain 2 are going to be all the measures that we're required to monitor for our health home, as each health home has across the state, for gaps in care. Things like 30-day, 7-day follow-up, chlamydia screens, for example. So children's and adult programs are a little bit different, but there are some similarities in some of those measures. The thing with that domain is often the scoring is 2 or 3 years of antiquated data that you're given a grade on at the redesignation, which is something that leads have been debating and arguing back to DOH for quite some time, because it's you can't do anything about it because the time's already passed and the data's it's old data by the time you get it. And then the chart audit, domain 3, that's weighted as well. So the weighting for each of these categories is being looked at as well. Like a 70, a 50, 20, 10, or a 30, 60, 10, something along those lines, as far as what each category would be weighed at. The chart audits is a big deal. That's as they look at their care management agencies throughout the network. So that goes back to our quality policy, the tools we've put in place to the network, the things we try to do to partner, enhance that with all of you through our work, and then the processes you have internally. We have tools like DataDen that we've implemented, the quality notebook, and then the tools that you would all have internally that you use as well for your quality management, all fall into that chart audit component, and then how that's being supported for the network. So that will cause us as a lead to look at this even more closely than we have already started to do in the last year and a half, since our new lead team has come into play. When my predecessor left, we've done a lot of work on the quality area to try and enhance and support that, not only as a lead but for the network. So this is going to cause leads across the state to take more, you know, um, action in those areas, unfortunately. So that means we'll be making sure if there's a cap or the step process for corrective action that we have to follow through, a little bit more diligently than maybe we would have in the past. Again, it's in policy. We've put it out. We've trained the network on it this year. We tried to roll into it over a couple months' time so that it wasn't as abrupt. Now we know these changes are coming. We really have to adhere to those policies as we move forward around quality management. Lori, I see, asked the question how we scored. So when we went through our redesignation last time, our adult program got a 2-year redesignation award, and the children's program got a 3, which was the highest in the state that you could get. The difference in the scoring category is if you had an 80% in the past, you would have a 2-year designation. That's not the case now. You got to have an 85. So it's like a 4 or 5 point slide that they're moving everything up, which is going to be a challenge for some health homes and organizations out there across the state to get there, depending on what their challenges are around quality management and training. So hopefully that answers your question a little bit. Um, any questions around this? I just wanted to get it out there for transparency for y'all that it's coming. It got sprung on us as leads within the past month. I do really think it's a look at, you got that budgetary cut that's coming across the state. Quality is going to be a big piece, following through management of that quality. And I think this is a step through policy that DOH is taking through their audit tool to do that. Um, I wasn't expecting it to come through the redesignation audit tool, but it's happening. Any other questions or thoughts around this piece? One other thing I wanted to mention before we go on is we will be updating our audit tool that we use when we audit our care management agencies in the network and have those updated once we get a chance to see what the new audit tool is that the state uses. That way we can align as much as possible with the types of questions that are being looked at and areas that are being focused on. Jess, you want to take this one?
Sure. So another thing that we've been noticing through our audit processes internally is just we wanted to touch on plan of care signatures. So as everybody knows, you can sign the plan of care directly in NetSmart, or you can print it and get a manual signature or wet ink signature, or you can use an e-signature platform and then upload that plan of care into the document section in NetSmart. We have been noticing that when we are auditing these plans of cares that typically there has been a signature, which is good. But when you're looking in the record, it is showing that the plan of care was signed directly in NetSmart. So someone signed with a mouse. And then when we go to check for signature, it's actually not there. Sometimes we'll see like a dash or a dot or something like COVID-19 written in the box, and it actually does not contain the member's signature. Um, so in order to obtain a signature on the plan of care, everybody knows you have to click the little button at the top that says client has reviewed plan. Then you're going to select the manual button and then save and close. If you are going to have the member use the mouse to sign the plan of care directly in the NetSmart, you're going to want to make sure you click mouse, and then you can use the mouse or the keypad to then physically sign the plan of care on the computer. Go to the next slide. So here's just a couple pictures. So again, you want to make sure if you are going to print the plan of care and get a wet ink signature that you are clicking manual. If you plan to have the plan of care signed directly on the computer by the member, that's when you click mouse. So we should never see mouse selected and then a dot, a dash, or something else noted in there. It has to be the actual signature of the member. And we do cross-reference these signatures to other signatures on file. And it has come up recently where we were cross-referencing signatures. You always want to make sure that you're getting the member's signature and it is accurate signature. And then a note for auditing. We know when we're auditing records, if we click on a member's plan of care, you can see that the first plan of care sample here, it says that it was signed manually. We know, okay, we have to go in external documents and we're going to look for that document. Also, if we see present under client signature, that notes that that member's signature was directly entered into NetSmart using the mouse or the keypad to enter it. However, when we go to review it, that's when we see that the member signature, in fact, isn't there. It's a dash, it's a line. Then we know as AHI employees in the health home to go look in external documents. However, when an outside person is auditing our charts, such as DOH, if we had an OMIG audit, anything like that, they would see client signature present, click on to review the plan of care, and then we would not get credit because the plan of care signature, in fact, is not there. And the auditor doesn't know that they need to then go look at documents to see if that plan of care was uploaded. So just a little reminder that if you're going to have the plan of care signed and then uploaded, so you're going to either do an e-signature or you're going to do a wet ink signature, please click manual. And if you're going to have the member sign directly in NetSmart, that's when you click mouse and collect the signature. Does anybody have any questions on plan of care signatures? Okay, if you have any questions, you can email the health home and we'll get back to you.
Thank you, Jess. I want to make folks aware, NetSmart just implemented as of June 1st, actually, a 60-day activity rule. So what's going to happen now for a user who has not been active in NetSmart for 60 days, their account's automatically going to be locked out. So they won't be able to get into Care Manager. It's not going to impact their Okta setting necessarily, but it will definitely impact their ability to log in. The process used to be, prior to June 1st, that NetSmart had to be the one to reactivate that account. That is something now that the health homes are our health home's gonna be able to do. So that helps as far as response time and getting people back on. Um, the other thing that's happening with this is there's gonna be intervals as far as, notifications that are gonna go out to users in the network for NetSmart. As you can see here, there'll be a 46-day, a 53, and a 59-day notification to the user, and as a reminder. So hopefully that will help prompt for folks who to need to reactivate that account, or I should say, get into that account before it needs to be reactivated. Um, and then what happens? So you get knocked out. What's going to happen? So basically, it's reaching out to the health home through the health home email, and that staff, you know, will whoever can get to it, whether it's Taylor or Courtney, will go and they would reactivate that account. Okta should not be an issue at that point. It's just putting the account back on live, and then you're going to have a 2-day time frame to log in after that reactivation. If it doesn't happen in that 2 days, it's going to deactivate again automatically. And this is what's been set up on the engineering end through NetSmart. So big difference is the person has 2 days, meaning the user, to get on that account once it's been reactivated as their time limit. And I didn't put another one, but I just thinking of it as I'm looking at it. And the other big difference is we don't have to rely on NetSmart to reset those accounts. Anybody have any questions around issues with reactivation or questions in general about it? Just know it's 60 days is a time limit, and then it be gone. You can't get in until you get let in. Okay. CFR. I had this up last month. I just wanted to put these few slides up again. Came off the training webinar through OMH. I don't know, a little over a month ago now. The reason I'm bringing them back up is because it's important for our designated organizations, for especially mental health population, to go through this process. I can speak internally through AHI. I was on a call with our finance team, with our CFR contact through DOH, and to start getting that process going. The feedback we got when we were on the call with the contact that was for us was that there's a lot of organizations in the same situation right now with this because the way that it came about, people are scurrying trying to get it happen. The CFR unit is not looking to penalize organizations as long as they're taking steps to start the CFR process for submission. Creating the account, going through the steps to do it, making effort to move forward. If a handful of months go by, I'm not going to, don't quote me when I say handful, but if some time goes by and you haven't taken the initiative as an organization, there could be potential penalties. And I think I saw somewhere along the line, it could be up to like a 20% withholding of your Medicaid billable activity until the CFR has been submitted. So I just want to make sure that folks are aware, if you haven't already, that you really want to take some attention to this. Make sure that your finance is involved. At AHI, we had our chief financial officer and our senior analysts involved with this, and they're taking it as the point. I've been in and out as far as being involved with it through our internal team. But it is very important, and depending on the type of organization you fall under, as far as the type of CFR that you file, that could be a difference in the length of that report that's filed as well. And and then the submission, the slide on how you submit that. There are some trainings, a number of trainings that go along with this, from my understanding. And the analyst through the CFR unit that we connected with was very personable, answered a lot of questions because we had a lot of questions. And I think they want to work obviously with organizations. So I just want to take some time to touch on this again. I don't know if anybody had any questions, thoughts, comments. It is a thing. It has to happen if you're designated as a specialty mental health provider through OMH for Health Home Plus population. All right. So that's the CFR. Budget recalibration. I wanted to just bring this up again. I highlighted in blue the things that I'm aware of through the various meetings we've attended with DOH recently. The only real update as far as the New York Health Home Coalition proposal to the budget response for DOH for consideration was the CEST, the Continued Eligibility Screening Tool. Assessment is going to likely be a thing. The DOH held their first subcommittee meeting with players last Thursday, and they're looking to meet weekly with the idea of having a draft completed in July of that assessment and to DOH leadership by early August. And the whole point is to get an implementation of this tool by 10/1. There's a lot of talk about this ideally taking the place of the comp assessment or a good part of the comp assessment to reduce administrative burden, and some discussion around HML disappearing or being altered as well. So as far as that flushing out, what that looks like, I don't have that yet, but that is in the discussion. And it is a standard assessment that would be used across all health homes across the state for consistency. And that would also help with determining eligibility level. So in recommendation 2, for example, if there was a step down care management rate code that were let in or adopted, if I would say, that would help to assess for that, so that we can see where people fall in the continuum for care there. There's no other updates outside of that. There's nothing more on the community health worker about wrapping that into health home. I know it's in discussion, but they didn't tip their hat on it when DOH was on with us last week on Friday. And then not a word on 1115 waiver yet either. So there's a lot of speculation that that decision on 1115 waiver is going to come through for New York State anytime. Whether or not health homes would be formally included in that, yet to be seen. That's all I had as far as the recalibration request from the coalition to DOH. I don't know if anybody had any other thoughts around that, questions, comments, additional information that I haven't provided that you're aware of that you wanted to share. Okay, we'll certainly keep folks updated as we know. And that was all we had today. Went sideways. Anybody have anything they wanted to talk about that we haven't mentioned today, or any questions, comments, thoughts? Nothing? Just looking forward to the 4th of July holiday coming up. I hope everybody has a safe one and has a lot of fun. You're going away, be safe. Lori says just hey everyone. Her microphone's not working. Have a great month. Yes, I hope everybody has a great month. Enjoy your summer. Hopefully the rain goes away and sun starts coming out a little bit more. As I always say, thank you all for everything you do, and much appreciated. And we'll be in touch soon. Take care, everybody.
Thank you, Travis.